in my clinical work, I don't use diagnoses at all. There are certainly lots of advantages that people talk about with diagnoses. One of the main advantages is that it helps communication between the different mental health professionals. So as a clinical psychologist, if I'm talking to a GP and I say, we're looking, I think I'm considering a diagnosis of PTSD, post-traumatic stress disorder here, then that the GP can kind of lock into that and sort of understand what where I'm coming from. Certainly some patients actually like getting a diagnosis, not all patients and clients, but some patients and clients feel that it helps them understand what's wrong and why they're struggling so much with the things that are going on. I don't use diagnoses because I don't find it helps inform treatment at all. So I work with people clinically just around the struggles that they're having in their life, and I spend time asking them lots and lots of questions about their struggles, and people have horrific things and really, really serious and important things going on in their life. So it's by not working with diagnoses, it's not at all minimising the seriousness of people's problems. It's actually doing the opposite. It's saying, I'm not going to focus on trying to fit you into these boxes that we've created. I'm going to try and understand from your perspective how difficult and horrendous and yucky life is at the moment, and see if we can together work out a way that you can start to make things better for yourself. So that's my approach. Very few people in routine clinical practice actually neatly fit any of the diagnoses, and there's been a lot of work done on that. There was a study recently, a couple of years ago now, that looked at more than 3,000 people who'd all been diagnosed with depression, and they found that there was an enormous amount of variability in the symptom profiles of those people. And when you look at different diagnoses, I think there's something like 175 different symptom patterns that will all achieve a diagnosis of post-traumatic stress disorder. For conduct disorder, because of the way the criteria work, there was a study by Alan Kasdan and one of his colleagues, and they reported that there are 32,647 different symptom combinations that will that will all satisfy the criteria for a diagnosis of conduct disorder. So when you start looking at that kind of variability, it's very difficult to mount an argument that the way we've constructed mental health disorders is similar to physical disorders like diabetes or tuberculosis or something like that. So for me, there's a range of reasons. I personally, in my clinical work, diagnoses don't help me be more helpful to the people I'm seeing, and even in discussions with my colleagues, I'd rather talk about the difficulties the person's experiencing from their perspective as they're experiencing them, rather than kind of try and mould them into a diagnostic category.